can imagine it must be really difficult for people to choose somebody to do a facelift surgery. I look on the internet at other people's websites, on Instagram, or other practitioners who do facial surgery, and sometimes even I'm confused by what they're offering. The truth of the matter is that a lot of what is out on the media is gimmicky, and we don't discuss the type of facelifts that they put out on the internet in our national meetings. There's no point during a National American Society of Plastic Surgery meeting that anybody is talking about celebrity lifts and lunchtime lifts and ponytail lifts and the like. We talk about how we do the surgery, which essentially is how we manage this SMAS layer, SMAS, which is the superficial musculoaponeurotic system. It's a layer of fascia underneath the skin. Fascia is like if you eat a piece of meat and you see that piece of gristle, there's that kind of tough layer under there. That's what fascia is. And we all have a layer of that underneath our skin on top of the muscles in our face. And the thing about SMAS, which is that piece of fascia, is that that is the layer that is what we use to affect lifting of the face. The reason we use it is because it's inelastic, and when we rotate it and change its position, we are going to restore the balancing effects of the face and the support structures in the face, and it's going to endure. Unlike if we just take out a piece of skin in the face, the skin is very, very elastic, so that may last a month or two, but then it's just going to stretch back out again. So when I do a facelift, and people who are really serious about facial surgery and doing these facelifts, the layer at which the facelift is done is the SMAS. So the question then that may differ from surgeon to surgeon is what we do with the SMAS layer. So some people fold the SMAS on itself and sew it to itself, and that's a SMAS plication. And some of us actually go underneath the SMAS, dissect it all the way down, and then really rotate it and reposition it. And that's the way I do it. I do what's called a high lamellar SMAS, or with a deep plane extension. But what that essentially means is that you go underneath that layer and really pull it up so that you're not causing any abnormal stretching of the skin, which can sometimes give that sort of wind-tunneled appearance, or will change the orientation of some of the inset wrinkles in the face and give you an unnatural look. When you reposition and you go into the deep plane underneath SMAS, you get not only an enduring result, but you get one that looks a lot more natural. And with further aging, maybe 10 years into the future, when you're going for a second facelift, if that's something that you're going to choose to do, is something that's repeatable without making you look like you've had multiple facelifts. So one thing that I will tell you is that my facelift is basically, it's going to be tailored to each individual person. Some people are going to need to have more skin removal than others. Some people will need to have a more extensive clearing of the structures underneath the neck. But in general, I'm never going to promise anybody a certain length of incision, because that's something that's completely unpredictable in the preoperative arena. I can promise you that you're going to have a suture line that is masterfully closed and is going to be as minimally visible as possible. I'm also never going to promise anybody a certain amount of recovery, because everybody's recovery process is different. Some people will bounce back in 1 week and will feel comfortable going out with their friends within a week's period of time, and some people will take 2 weeks to have the bruising go away. Some people will look okay within 2 weeks, but still won't feel comfortable going out with their friends for a month after their surgery. And that is really an individual thing. So I could tell you averages. I could tell you on average, most people are able to go out to a restaurant, be in front of strangers without causing alarm within 2 weeks of their surgery, but they still won't feel completely like themselves till about 3 months after surgery. I tell people most people are picture ready by about 3 months. But again, that's something that's going to be variable and individual and will really be dependent on the way people react to their own changes, as well as how well people heal, how much they swell, and everybody's different in this respect.